Hello everyone, welcome back to my channel again today. I'm Chioma Leo and I have a particular medical condition I'll be discussing with us today, and that is peptic ulcer disease, PUD. I'll be telling us what it is all about, the causes, the symptoms, the preventive measures, and I'll be giving you some hints on how doctors usually help out with the treatment. Now, peptic ulcer disease is a gastrointestinal condition that is characterized by sores or lesions, ulcers in the lining of the stomach and the duodenum. The duodenum is the first part of the small intestine. So, peptic ulcer disease can happen in the stomach or in your duodenum. That is where we have the two major types of peptic ulcer disease, which is the gastric and the duodenal ulcer, depending on the location of the ulcer. Now, what are the causes of peptic ulcer disease? The first one I have here is infection by Helicobacter pylori, that is H. pylori. Is a bacteria that usually causes ulcer. Then other causes include smoking, excessive alcohol or alcohol consumption, stress. Then also family history too. There are some people who have family history of ulcer. They are more likely to develop ulcer in the future. Then another thing is long-term use of NSAIDs. What are NSAIDs? They are called non-steroidal anti-inflammatory drugs like the aspirin, ibuprofen, and all that. If you are taking these kind of drugs all the time, it could predispose you to ulcer, and it is very bad for your health. Now, so I've mentioned the causes of ulcer. Then now I'll be telling you some of the preventive measures now. If you want to really prevent ulcer, you need to maintain a good and healthy feeding or diet. You need to watch the things you eat. You need to limit your spicy foods and all that, fatty and all these kind of foods that could irritate your stomach lining. You also need to manage your stress. I made a video last time in one of my YouTube videos about stress and its management. Now, you can see how stress can be so devastating. Stress can affect not only your mental health, it can also affect your physical health. Now, if somebody is stressed up so much, it can lead to increased gastric acid production, and that is what erodes or ulcerates the stomach lining or your duodenum. So that is it. You need to watch, and you need to watch your stress level, and you also know when to manage it correctly. You also need to avoid smoking and avoid taking alcohol, because these are also culprits that could make you to come down with ulcer. You also need to get tested for H. pylori infection, Helicobacter pylori infection. You need to check your blood. If you have such infection, the doctor will treat you quickly so you don't complicate the condition. You also need to practice good hygiene. When you practice good hygiene, you could prevent and avoid infections from any form of bacteria, especially this major one that causes ulcer, the H. pylori. You can avoid that by practicing good hygiene. Now, for the treatment aspect, I will not be talking about that in detail. When you go to the hospital, depending on the cause of the ulcer, your doctor would prescribe drugs to you. If you need acid reducing medications, they will give to you. If it's antibiotics, they could give to you. If it's proton pump inhibitors, they can also prescribe for you. If you have this kind of symptoms I mentioned earlier, not gnawing pains or burning pains at the upper parts of your abdomen, yeah, you have vomiting and all that, you can go to the hospital. Do not self-medicate, and don't just conclude you have ulcer. You must make sure the doctor diagnoses you and knows and finds out his ulcer, and also gives you the treatment you need. Then another thing, there are some people who say, they said I have ulcer, then why am I feeling chest pain? Yes, ulcer pain can 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 make people to feel to have heartburn. It could be a referred pain. When you are having ulcer, whether in the stomach or the duodenum, the pain can radiate to your chest region. That is why you see most people feel like a burning sensation in the mid chest, or they have heartburn, or they say they have heartburn, that the ulcer makes them to have heartburn. So that is it. Then another thing, it could be a gastroesophageal reflux. It could also be a reflux, gastroesophageal reflux. When the stomach acid is too much, it could go back up into the esophagus, and which could lead to this burning pain in the chest. Then, so this is the some of the reasons that could make you to feel chest pains or maybe heartburns when you are having ulcer. Then now, if you leave ulcer untreated, it could lead to bleeding. And when you bleed for long, it could lead to anemia, to shock, and even organ failure. And it could even lead to death. That is if you leave ulcer untreated. Some people just see it as a common something. It's not common. When you leave it untreated, it is very deadly. And it could also lead to perforation. That is when maybe the stomach lining or the duodenum lining perforates, opens up, and allow bacteria to enter into your abdominal cavity, which can lead to peritonitis, abscesses, and even sepsis. And these things are so terrible. When it happens to a person, the person may even die on the process. So complication of ulcer can be so bad and terrible. If you have symptoms of ulcer, the best thing to do is to go to the hospital. Let a doctor diagnose you and get you treated adequately. Thank you so much for listening and tuning in today. I would see you next time with another special topic. Please share, like, and subscribe to my channel for more health talks. Bye bye.